Good morning. Hello. My name is Dr. Cassie Tronco.
And I am Dr. Zoe Crawford.
And we're doctors of physical therapy. Today we are going to talk about how expectations can change your outcomes, whether or not they're positive or they're negative.
The idea that we're using here is using the placebo and nocebo. So placebo means I shall please, and nocebo means
I shall harm.
Right.
And
we normally have looked at the placebo effect or using a placebo in research as the control, right? One group gets the procedure or the medication and then somebody else gets the sham version of it. We know now from different studies that have come out recently that when the placebo matches the procedure or the medication, we're looking at how the psychology of that works, right? Somebody gets the procedure, somebody doesn't get the procedure, they have the same outcome. Why is that? We're learning more that, as we were saying, that expectations guide the outcomes more than anything else.
Mm-hmm. Exactly, and I think there's been so many different studies that show this, just as Zoe was saying. One that I can think of that Zoe's told me about is people with knee pain or any knee condition. They went in to have surgery, but actually what happened is the surgeon just cut open their knee, sat there with the patient on the exam table, sewed them back up, and then when the patient woke up, they said that they had better knee pain.
They felt better.
Yeah, exactly. And so, just as Zoe was saying, it's not necessarily the actual procedure, but it's your expectation that you think you're going to be better.
You're going to be better, right? You walk in, you have knee pain, you go see a physician, they tell you this surgery will work, therefore you have it framed in your brain that will make you feel better.
Mm-hmm.
I think that's the important part of kind of where we're going with all of this, is the fact that the expectations will always drive the results, or at least for the most part. And that's an important part of our job as physical therapists, is understanding those perceptions, the expectations of our patients and our clients before they get here. If they've had, right, I think we look at this, maybe not a bad experience with physical therapy, but sometimes that's the case. More often than not, it is bad experiences with movement or exercise.
Yeah, definitely. What can happen with that is if, say for instance, if you had an injury with you falling while doing CrossFit or while walking, your brain, anytime that you think about doing that again, or if somebody suggests, hey, let's exercise by doing this, you're going to say, no, that's not going to help me. Or, which is kind of more so like the nocebo effect. Also, I've heard a lot of people say, like, I'm too weak to do this, or my body doesn't move like this, I can't do it. Well, obviously, if you say that, nothing's going to change. So again, going back to what Zoe's been saying about making sure that you're setting the correct expectation and mindset, ultimately your brain is in control. Like your thoughts, that's what you're in charge of. You can't control that we have an aging body or that you have a medical condition or you have an injury, but what you can control are your thoughts.
Yeah.
And that's so powerful.
I think we also look at this in terms of MRI reports. We know, right, because we are research nerds, that those two things don't necessarily correlate, right? There's certain words, degenerative disc disease, osteoarthritis, degenerative joint disease, all of those words, right? Disease pinch nerve. All of those things create damage, they create trauma, they create this very negative connotation from the fact that the word disease means normally we don't have control over it, right? And we know that that's not true. So luckily, everybody, right, within the medical community, we're trying to kind of reframe these terms because we know that the expectations of our patients, it has a huge impact on recovery. Everybody, physical therapists, orthopedics, surgeons, everybody, they want their patients to feel better. So if we start off with more positive language, means our patients have better outcomes.
Exactly. And I mean, so you mentioned like degeneration. I mean, this is is something that I say all the time, is that arthritis is just like gray hairs and wrinkles, which is inevitable. You can see somebody on their outside, they look older. It's just arthritis is gray hairs and wrinkles on the inside.
That's good.
Age is degeneration, where we are all degenerating, unfortunately. We will get there eventually. We're not there yet.
Slowly.
But yes. So, I almost don't like using it as almost an excuse, or if you're kind of just putting yourself in that mindset that like, well, I degenerated and I can't do anything, well, then no, you won't be able to do anything.
Right.
Yeah.
Right. Creating that mindset from the get-go, saying, I can do this, I will do this, and creating that expectation does improve our outcomes. I think we also, in certain situations, creating a better mindset about ability as opposed to disability is also important. I think that we have an injury, maybe we don't feel as great and as spry as we want to, but there's still a large grouping of things that we can do. And that mindset and that shift, the gratitude and appreciation that we always like to bring in, that's important, because if we're consistently set on what I can't do, it's creating a negative connotation to everything around you and everything that you can do, right? It's always this little gray cloud over everything that you are able and you can do well.
Yes, yeah. Which we wouldn't want. We sunny skies, blue skies.
Yeah.
So bottom line is really just that your brain is in charge of your experience, whether it's your experience in exercise or just your experience in life. And it's not always going to be sunshine and rainbows. Obviously, you have cloudy days and rainy days, but trying to shift that mindset into a more positive life will help you manifest a more positive life. Yeah.
And not always creating that expectation of A plus B equals C. I went for a run on the grass, therefore my knee is going to hurt. That can't possibly be the situation. Something, it's not an always, maybe it happens once in a while, but even just telling yourself that I can do that every now and then, but I have to change my mindset so that I can feel better.
Yeah,
right?
yeah.
Something always doesn't happen every single time.
Yeah.
I would argue that.
Yes.
So, reframe your mindset, understand that your mindset has a huge impact on how you function as a human, definitely has an impact on your ability to improve your activity levels, improve pain, and recover overall. And know that that's just right. Good expectations and having a sunny side of things is always important.
Yes.
We have some workshops that are being set up at the Lake Travis Library through Zoom, so keep an eye out on that. And Cassie will be doing a Zoom workshop for neck pain and posture. That's Monday,
At noon.
Yeah, Monday, June 9th at noon. You can either click on or go to our website and we'll have that posted, Facebook or Instagram, or you can go to the Lake Travis Library and you can get the link from there. So we hope you have a lovely day and we will see you guys next week.
Yes.